What does a stage I lymphoma diagnosis mean for prognosis? Getting a diagnosis of stage I lymphoma can feel overwhelming, but it actually often means the disease is caught early, which is good news. In non-Hodgkin lymphoma, stage I means the cancer is limited to one lymph node region or possibly a single organ outside the lymphatic system. This early stage suggests the cancer has not spread widely, making treatment more straightforward and increasing the chance of a positive outcome. Because the lymphoma is localized, treatment options tend to be more effective. The typical approach involves a combination of therapies like chemotherapy and sometimes radiation therapy, aiming for remission or even cure. The 5-year survival rate for people diagnosed at this stage is quite high, around 87%. This means most people with stage I non-Hodgkin lymphoma are likely to live at least 5 years after diagnosis, compared to those without the disease. But it's important to remember that these are general statistics based on large groups, and individual outcomes can vary. Many factors influence prognosis beyond just the stage. The specific type of non-Hodgkin lymphoma matters because some types respond better to treatment than others. A patient's age and overall health also play a role. Healthier, younger individuals often have better chances of successful treatment. Symptoms like fever, night sweats, or weight loss, known as B symptoms, can sometimes indicate a more aggressive disease, which may affect prognosis. How well the lymphoma responds to initial treatment is another key factor. If the cancer shrinks or disappears quickly, the outlook tends to be more favorable. Treatment success in stage I lymphoma is often quite promising, especially for aggressive subtypes like diffuse large B-cell lymphoma, where many patients achieve long-term remission. Less aggressive types, called indolent lymphomas, might be managed with watchful waiting if they are not causing symptoms. It's also worth noting that ongoing research and advances in medical care continue to improve treatment options and survival rates, so outcomes are getting better over time. While a stage I diagnosis generally offers a better outlook than more advanced stages, each person's situation is unique. Factors such as individual health, the biology of the lymphoma, and how early the disease was detected all influence prognosis. Regular follow-up with healthcare professionals is essential to monitor for any signs of recurrence and to manage side effects from treatment. In summary, a diagnosis of stage I non-Hodgkin lymphoma usually indicates a localized cancer with a more favorable prognosis. Early detection and appropriate treatment are crucial for the best possible outcome. However, because every case is different, personalized medical advice from a healthcare team is vital to understand what these statistics mean for each individual. Always consult your doctor to get guidance tailored to your specific health situation.